I want you to take a moment and think about something. How many times have you seen moringa recommended online in smoothies, capsules, powders, teas, and thought, okay, but is this actually safe for me? Because I have to be honest with you. Most of the content out there about moringa is either aggressively promotional, trying to sell you something, or it skips right past the important nuances that every real person deserves to know before putting something new into their body. And today, I'm not going to do that to you. I'm going to sit down with you, speak plainly, and walk you through what the science actually says, what the real risks are, who should be cautious, and how to use moringa if you decide it's right for you, without fear, without hype, and without glossing over the parts that matter most. Now, before we go any further, I want to ask you something directly. Have you already tried moringa or are you still on the fence about it? Drop your answer in the comments below. Tell me where you're at. Are you a moringa enthusiast who's been using it for a while, or are you someone who just heard about it and wants to know the truth before you start? I genuinely read your comments, and your experience matters to this conversation. So let's make this interactive. Tell me what brought you here today. All right, let's start from the beginning because I think context is everything when we talk about plant based health supplements. Moringa oleifera, that's the full scientific name, is a tree that's native to parts of South Asia, particularly northern India, but it's also grown widely across Africa, Latin America, and Southeast Asia. People have been using various parts of this tree for thousands of years. The leaves, the seeds, the pods, the roots, even the bark, all of it has been used in traditional medicine systems across multiple cultures. And when something has that kind of deep historical use, it's worth paying attention to. Traditional wisdom isn't always perfect, but it's usually pointing at something real. So, what's the appeal? Why has moringa exploded in popularity over the last decade or so, especially in wellness communities? Well, when you look at the nutritional profile of moringa leaves, particularly the dried powder, it's genuinely impressive. We're talking about a plant that contains significant amounts of vitamin C, vitamin A, calcium, potassium, iron, and protein. And not just protein in general. Moringa contains all 9 essential amino acids, which is unusual for a plant. It also contains a range of polyphenols and antioxidant compounds, including quercetin, chlorogenic acid, and isothiocyanates, which are the same class of compounds found in broccoli and other cruciferous vegetables. So the excitement around moringa isn't coming from nowhere. There's genuine nutritional substance here. But here's where I need you to stay with me. Because a food or supplement being nutritious and having a long history of traditional use does not automatically mean it's without risk. And it absolutely does not mean it's right for everyone. That distinction between something being potentially beneficial and something being universally safe is one of the most important things I want you to take away from this conversation. So let's talk about the side effects, the real ones, with honesty and clarity. The first thing I want to address is something that often gets buried at the bottom of supplement articles, if it gets mentioned at all, and that is the question of dosage. Almost everything in medicine and nutrition is dose dependent. Water can be dangerous in excessive amounts. Vitamin A, which is actually found in moringa, can be toxic at high doses. So when someone asks, is moringa safe? Part of my answer has to be, it depends enormously on how much you're taking and how often. The amounts found naturally in food portions of moringa leaves, say a teaspoon of powder added to a smoothie or a handful of fresh leaves in a meal, are generally considered safe for most healthy adults. That's the food level use. But when you start taking concentrated capsules or extracts, sometimes marketed at very high doses, that's when the risk profile starts to shift. So, please, if you've been taking moringa in supplement form, look at the dosage on that bottle. It matters more than most people realize. Now, let's get into specific side effects that have been documented either through research or through consistent clinical reports. The most commonly reported side effect of moringa, particularly when it's taken in high doses or on an empty stomach, is gastrointestinal discomfort. I'm talking about nausea, loose stools, stomach cramping, and diarrhea. These effects are not rare, and they're not minor for the people who experience them. If you've started Moringa and noticed that your stomach has been unhappy, that is likely the reason. The good news is that this side effect is usually dose dependent and tends to resolve when the dose is reduced or when moringa is taken with food rather than on an empty stomach. So, if this has been your experience, don't assume moringa just isn't for you. Try adjusting how and when you take it before you make that decision. The second side effect I want to talk about is one that has significant implications for a large portion of the population, and it's the interaction between moringa and blood pressure. Moringa has demonstrated hypotensive effects in multiple studies, meaning it can lower blood pressure. Now, for someone with hypertension, that might actually sound like a good thing. And in some contexts, it might be part of the picture. But here's the concern I want you to really hear. If you are already taking blood pressure medication, anything from lisinopril to amlodipine to metoprolol, adding moringa to your routine could cause your blood pressure to drop lower than your medication is already bringing it. And blood pressure that drops too low, a condition called hypotension, can cause dizziness, fainting, falls, and in severe cases, cardiovascular complications. This is not a theoretical risk. This is a real pharmacological interaction that deserves serious respect. So, if you are on blood pressure medication, please have a conversation with your doctor before adding moringa to your routine. That conversation is not optional. It is genuinely important. Closely related to this is moringa's effect on blood sugar levels. There is research, some of it quite promising, suggesting that moringa may help improve insulin sensitivity and lower blood glucose. Again, for someone who is pre diabetic or trying to manage their metabolic health through lifestyle, that sounds encouraging. But the same logic applies here. If you are already taking medication for type 2 diabetes, metformin, glipizide, insulin, or any other glucose lowering drug, moringa's blood sugar effects could stack on top of those medications and push your blood sugar too low. Hypoglycemia, which is low blood sugar, can cause shakiness, confusion, heart palpitations, sweating, and in serious cases, loss of consciousness. Again, this is not me trying to scare you away from moringa. This is me asking you to be smart and coordinated about your health. Talk to your prescribing doctor. Tell them what you're considering. Let them help you make an informed decision. Now, I want to spend some time on a group of people for whom moringa carries specific and well documented risks that go beyond general caution, and that is pregnant women. I want to be especially clear and direct here because I know many people come to natural supplements looking for safe options during pregnancy, and I deeply respect that impulse. But when it comes to moringa during pregnancy, the evidence points to real concern. Specifically, the roots, bark, and flowers of the moringa plant contain compounds, including alkaloids and other bioactive substances, that have been shown in animal studies to have uterotonic effects. That means they can stimulate uterine contractions. In traditional medicine, in some cultures, parts of the moringa plant have historically been used precisely for this purpose to induce labor or to cause miscarriage. I want you to sit with that for a moment. This is not a minor footnote. This is a reason why moringa, particularly in supplement form and particularly the non leaf parts, should be avoided during pregnancy unless you are under direct medical supervision and your doctor has specifically said it is appropriate for you. Moringa leaf in small food amounts is generally considered lower risk than concentrated extracts or other parts of the plant. But even then, the safest guidance during pregnancy is to avoid moringa supplements entirely and to consult your healthcare provider before using moringa in any form. If you are pregnant and you've been using moringa, please bring this up with your OB or midwife at your next appointment. And if you are planning a pregnancy, make this part of your preconception health conversation as well. Let me shift now to a side effect category that is less commonly discussed but increasingly important as we understand more about drug herb interactions. And that is moringa's potential to interact with medications processed by the liver. Many pharmaceutical drugs are metabolized by a family of liver enzymes called the cytochrome P450 system. Some early research suggests that moringa may influence the activity of certain enzymes in this system. Why does this matter? Because if moringa affects how quickly or slowly your liver processes certain drugs, It could either cause those drugs to build up to higher levels than intended in your body, or it could cause them to be cleared too quickly and lose effectiveness. The drugs that are most commonly affected by this type of interaction include certain anticoagulants like warfarin, some psychiatric medications, certain cholesterol lowering drugs, and some antiretroviral medications used to treat HIV. The research in this area is still developing and is not conclusive, but it's a reason to be mindful and to mention your moringa use to any prescribing physician who is managing you on complex medications. This is actually a broader point I want to make. One of the biggest gaps in how people use supplements, and I see this constantly, is the failure to mention them to their doctors. I understand why this happens. Sometimes people feel like their doctor will dismiss the supplement. Sometimes they worry about being judged. Sometimes they just don't think to bring it up because it's natural and they assume natural means harmless. But from a clinical standpoint, natural and harmless are not synonyms. Arsenic is natural. Hemlock is natural. The naturalness of something tells us nothing by itself about its safety profile. What matters is the specific bioactive compounds, the dose, your individual health circumstances, and any medications you are taking. So please be open and honest with your healthcare team about everything you're putting in your body. They can only help you if they have the full picture. Now, one more side effect I want to bring up, and this one surprises a lot of people, is related to moringa's thyroid effects. Moringa contains compounds called isothiocyanates, which in very high concentrations can interfere with thyroid function. Specifically, there is some concern that high amounts of moringa could affect iodine uptake in the thyroid or interact with thyroid hormone production. For most healthy people taking normal amounts of moringa, this is unlikely to be a significant issue. But for someone who already has hypothyroidism and is on thyroid hormone replacement therapy like levothyroxine, this is another reason to have that conversation with your doctor first. The thyroid gland is remarkably sensitive, and even modest shifts in the compounds affecting it can influence how well your medication works. This doesn't mean moringa is categorically off limits for people with thyroid conditions. It means the decision deserves personalized medical guidance rather than a blanket yes or no. Let me also touch on allergic reactions, because while they are not common with moringa, they are real. Some people do experience allergic reactions to moringa, particularly in the form of skin rashes, itching, or in rarer cases, more significant reactions. If you are someone who has known allergies to other plants in the same botanical family, which includes plants like horseradish and mustard, you may have a higher baseline risk of reacting to moringa. And as with any new supplement, the smart approach is to start with a small amount and observe how your body responds before increasing to a higher dose. Your body is almost always trying to communicate with you. Learn to listen to it. Now, I want to make sure this conversation doesn't leave you thinking that moringa is a dangerous thing to be avoided, because that's not the full picture, and I don't want to leave you with an incomplete one. For many people, healthy adults without major underlying conditions, not on complex medications, using moringa in reasonable amounts, moringa is very well tolerated and may offer genuine nutritional support. It is a genuinely nutrient rich plant with a long history of safe use in food traditions across many cultures. The leaves, in particular, used as a cooking green or added in small quantities as a powder, have a safety profile that compares quite favorably to many other common dietary supplements. The conversation I'm having with you today is not a warning to stay away. It's an invitation to approach moringa and all supplements with the kind of thoughtful, individualized attention that good health actually requires. So, let me walk you through what smart, safe moringa use looks like for someone who has decided, after considering the factors we've discussed, that they want to give it a try. First, choose your product carefully. Look for moringa leaf powder or moringa leaf products from reputable companies that third party test their products for purity and contamination. This matters because supplement quality control in many markets is inconsistent, and you want to know that what's in your supplement is actually what the label says, and nothing more. Certifications from organizations like NSF International, USP, or Informed Sport are good markers of quality. Second, start low and go slow. A common recommendation for moringa powder is to start with half a teaspoon per day and work up gradually, paying attention to how your body responds. There is absolutely no benefit to jumping to the highest possible dose immediately, and considerable downside risk to doing so. Third, take it with food. I mentioned earlier that GI side effects are more common when moringa is taken on an empty stomach. Taking it as part of a meal or blended into a smoothie with other foods can significantly reduce that risk. Fourth, be consistent but not obsessive. Nutritional benefits from plant based supplements tend to accumulate with regular, moderate use over time. You don't need to maximize every dose. A steady, reasonable habit is far more valuable than an inconsistent burst of high dose use. And fifth, and I can't emphasize this enough, stay in dialogue with your healthcare provider. Use Moringa as one part of a comprehensive approach to your health, not as a replacement for medical care, not as a cure for any diagnosed condition, and not without the knowledge of the professionals who are helping you manage your health. The supplement industry sometimes positions its products as alternatives to conventional medicine. I want to be very clear that I don't see it that way, and I don't think you should either. Moringa, at its best, is a nutritional complement to a healthy lifestyle. It is not a treatment, it is not a cure, and it works best when it's part of a broader approach that includes good nutrition, regular movement, adequate sleep, stress management, and regular engagement with your healthcare team. I also want to speak directly to those of you who may have read dramatic headlines, either wildly positive ones claiming Moringa cures everything, or alarmist ones claiming it's dangerous and should be avoided by everyone. Health communication in the digital age tends toward extremes because extremes get clicks. But real health decisions live in nuance. Most things that are genuinely good for your health are not magical, and most things that require caution are not categorically dangerous. Moringa fits squarely in that middle space. It has real nutritional value. It has real documented interactions and risks for specific populations, and it deserves to be treated with the same balanced, evidence informed thinking you would apply to any other health decision. Before I wrap up, I want to circle back to something I said at the very beginning. I said that most content about Moringa is either aggressively promotional or glosses over the nuances. And part of why I feel so strongly about giving you a complete, honest picture is that I believe you deserve to be a fully informed participant in your own health. Not a passive consumer of supplement marketing, not someone who makes decisions based on fear or hype. A real empowered person who understands the relevant factors and makes choices based on their own unique situation with support from people who genuinely know what they're talking about. That means if you take one thing from everything I've shared today, I want it to be this. The question isn't just, is Moringa safe in the abstract? The real question is Moringa safe for me right now, given my health history, my current medications, and my specific goals? And answering that question well requires personalization. It requires some self knowledge, some research, and ideally a conversation with a trusted healthcare provider who knows your full health picture. You have every right to take an active role in supporting your health. You have every right to be curious about what plants and foods might offer you. And you have every right to be cautious, to ask questions, and to take your time before adding something new to your routine. All of those instincts are healthy and good. Trust them. Slow down when something feels rushed. Ask for more information when something feels incomplete. And never let anyone, supplement company, wellness influencer, or well meaning friend, pressure you into a health decision you haven't fully thought through. Now I want to hear from you again. After everything we've talked about, where do you land? Has this conversation changed how you're thinking about Moringa? Are you feeling more confident, more cautious, or somewhere in between? Drop your thoughts below. And if you have specific questions about something I covered or something I didn't cover that you're wondering about, let me know in the comments and I'll do my best to address it. Your questions make these conversations better, and they help me understand what you actually need to hear. Thank you for spending this time with me today. I know there's no shortage of health content out there, and I don't take it lightly that you chose to be here for this one. I hope it's given you something genuinely useful, not just information, but a way of thinking about supplement decisions that will serve you well beyond Moringa for every health choice you make going forward. Take care of yourself, ask good questions, and I'll see you in the next one.